Well, we're going to keep going. As I said, this is Terri Crowder Davis. She is one of our lead cardiac techs here at Emory, Midtown, and she'll be talking about technical factors in CT. And I'll let her take it away. Cool.
Good morning. As he stated, I'm Terri Crowder Davis. I'm one of the lead CT technologists at Emory, Midtown. I'm going to be discussing the CT scanner technical factors. Understanding the parameters that impact the image qualities of radiation dosage. The objective here is to review the key scanner technical factors, understanding the effects on the image quality, recognizing the impact on radiation dosage, and applying the principles to optimize patient exams. What is KVP? Controls the energy of the X-ray beam. Effects of the increase of the KVP, greater beam penetration, reduces the image noise, improved image in larger patients. Consideration, higher KVPs increase radiation dosage. Lower KVPs may improve iodine contrast enhancement. That is very important in most of the patients that we are scanning today. The typical cardiac CT ranges is 80 kVp, 100 kVp, and 120 kVp. The key points, use the lowest kVp that produces diagnostic image quality. As the technologist, and I always tell the technologist that I am training and that I run into, they will sometimes look at a patient, and like I said, they will trust the scanner at times to do what they think this was best. And then they will come out with an image, and the physician will come back to the technologist. And I get this question all the time from one of our physicians: what happened to this image? And my technologist cannot explain to the physician exactly what happened to the image quality. Sometimes as a technologist, we need to look at our parameters and make sure that all of our parameters are set up correctly so that we can get the best diagnostic qualities for our reading physicians. Oh, what do you say? All right. Our two current and exposure times. What is MA? It controls the number of X-ray photons produced. Increased MA reduces image noise, improves image quality, which we do want that improved image quality. Decrease in MA lowers radiation dosage, may increase image noise. This goes back, technologists, to our basics of radiology, okay? Dose reduction tools. We have our automatic tube current modulation, of course our ECG-based dose modulation, patient size-based protocol selection. You have to be careful on which scanners that you are operating on in your operating systems. Key points: balance image quality with your radiation safety. Your pitch. Table movement relative to your beam width. Low pitch, higher image resolution, higher radiation dosage. High pitch, faster acquisition, lower radiation dosage. Your rotation time. Faster radiation reduces motion artifact. That is so critical when we're doing cardiovascular imaging. Okay, be very careful about the rotation times and the reduction of motion artifact. Slice thickness. Thin slices improve spatial resolution. Thick slices reduces noise. So the key points here, these factors directly affect motion control and image detail. So your image quality and dose management. Remember the four major factors: your KVP, your MA, your pitch, and your slice thickness rotation times. Best practices: use patient-specific protocols. Apply your automatic exposure control. Minimize radiation dose while maintaining diagnostic quality. Please follow your ALARA. Follow your ALARA, but please still get the best diagnostic image quality for your patients and for your physicians, please. And obviously for your patients. We are here to be patient advocates. So we do not want those repeat exams and, the exams that our physicians cannot read. One thing that, most people that know me, I'm a perfectionist. And when I go back and read reports, one thing I do not like to see is, mid-RCA is not diagnostic, or, proximal LAD is not. I don't like to see undiagnostic anywhere in one of my reports from my physicians. So the take-home message. The goal is not to have the prettiest image, even though that's my goal. The goal is not most of the time to have the prettiest image, okay? it is to have the lowest dose still as possible and provide, diagnostic quality images. Okay, so for those of us that, have OCD, and those of us that, we have to just get the best exam 100% all the time, just realize that, everything is not 100%. All right, we just sometimes have those technical factors, or we just have those patients that can't get that arm up, or those patients that, we told them to, went over breathing with them multiple times, or they've had a stroke, or, sometimes there's factors that we cannot control. But as technologists, our job is we can just do the best that we can, advocate for your patient, and just get the best image quality that you can for your physician so they don't have to have that non-diagnostic reading. And with that, thank you.